This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2025. Total knee replacement, or TKR, is the standard treatment for end-stage osteoarthritis. Computer-assisted technologies, including computer navigation and patient-specific instrumentation, were introduced to improve implant alignment and surgical precision. However, their impact on patients' clinical outcomes remains debated. This observational study analyzed data from the National Joint Registry in the UK to evaluate the effects of TKR performed with the assistance of computer navigation and patient-specific instrumentation compared to conventional instrumentation. The primary outcome was the risk of all-cause revision. Secondary outcomes included differences in the Oxford Knee Score, or OKS, and EQ-5D3L at 6 months postoperatively, as well as mortality within 1 year postoperatively. Statistical analyses used propensity score weighting to help control for confounding by indication and several additional confounding factors. Findings indicated no significant differences in the risk of all-cause revision between conventional and computer-assisted TKR. Similarly, functional outcomes and health-related quality of life, that is, OKS and EQ-5D3L scores, did not differ significantly between groups. Postoperative mortality rates within 1 year were also comparable. These results suggest that TKR, performed with the assistance of computer navigation and patient-specific instrumentation, does not confer clinically meaningful benefits in revision risk, functional outcomes, or mortality compared to conventional TKR. Given the higher costs associated with these computer-assisted technologies, their routine use in unselected TKR cases should be reconsidered if the objective is to improve these outcomes.